Okay, so now I'm ready to do my 8 o'clock, 8 a.m. med pass. I have checked the doctor's orders with the Mars. Everything looks okay. However, one of the medications that I was supposed to give was Bactrim, and according to his charts, he's allergic to it. So we need to be calling the physician. For his 8 o'clock meds, his metoprolol, I would want to check maybe his LDH levels and maybe even the uric acid levels, because sometimes it makes it go up. And digoxin. Check his digoxin levels, electrolytes, and potassium. I would also want to see kidney function, see how his kidneys are doing. So for the metoprolol, I am going to want to, of course, get the blood pressure and the pulse, but in particular, I need to pay attention to his pulse, and I need to do it for a minute. If it's below 60, I need to hold it and call the doctor. Or if the systolic is lower than 90, I would also need to hold it and call the doctor. I also maybe will even look in his chart to see how his blood pressures have been running. For his digoxin, I will also do the same. His pulse, if it's below 60, I would hold it, or if it's over 110, I would hold it and call the doctor. For the digoxin, sometimes that indicates that there may be a toxicity, a digoxin toxicity. So, like, I would ask him what kind of symptoms he was having, if he described as visual disturbances with like yellow halos, muscle weakness, and hypotension, arrhythmias. I would want to pay close attention to that with these medications. Also, dry mouth would be another one. So I would ask him to report all that. Okay, so I verified the orders. They're okay with the MAR. Checked his diagnoses and the medications that he's taking coincides with the disease process. The only thing I found was the Bactrim. We probably should not get that, and to call the doctor. Hi, my name is Rhiannon, and I'm from Highland Community College. This is my instructor. She's going to be watching over as I do your medication pass. It is okay if I do give you your medicine today? Okay. Can you please tell me your name and your date of birth? I will compare his name and his date of birth to whatever record I have in front of me, which happens to be a MAR. I would check his bracelet. We could even scan it, but we don't have a scanner. Okay, everything checks out. Okay, Mr. Truman, can you tell me your allergies? Okay, so he verified that he is allergic to sulfa. I am going to ask him every time I come in here, because sometimes people remember they're allergic to something else. So it's always a good thing to ask and ask and ask. Okay, so for this, Mr. Truman, I have your 8 o'clock meds and metoprolol. And that is your antihypertensive medicine that'll help you lower your blood pressure. So we're going to be paying attention to your blood pressure. This helps with decreasing your cardiac output, which means that your heart isn't having to work so much. And then we are going to give you digoxin. This just strengthens your heart muscle contractions. So I'm going to need to assess your blood pressure and your pulse. Maybe I'm gonna even check your lungs too. Just want to make sure they're clear. So once again, I would check it for a minute. And if it's below 60, I would hold it. If his systolic is under 90, I would hold it and call the doctor. But his blood pressure is fine, his pulse is fine. We have a regular rhythm. Are you experiencing any dizziness or visual disturbances such as hallucinations or double vision, color changes? Okay. Do you feel like your heart's okay? You're not feeling extra beats, dizziness? Okay. So every time I do come in here though, being that I know he's on diuretics and anticoagulants and he's a diabetic, I'm still gonna assess his edema and his skin. I also wanna make sure he's not having an allergic reaction, like the Stevens-Johnson syndrome. So I'll be checking all that too. Okay, so we're gonna get this ready. We're gonna get your metoprolol. Okay. Your metoprolol is supposed to be 75 and we have 50. Okay, so for the metoprolol, there's 50 and we're supposed to have 75. I would check to see if they're scored. If they're scored, I would go ahead and cut one in half. Okay, and I'm going to put it in the sleeve. And, oh no, where's my slicer? Okay, I'm going to check it again. 50, metoprolol, 75. Okay, so I'm going to need half another tablet. And I'm going to stick it in my cutter. You gotta make sure it's scored. If it's not, you could always call the pharmacy and have them switch or get a different pill. Not that it needs to be a different brand or anything, but maybe they have one that's scored, or we will need to figure it out. So I'm gonna cut one in half. Okay. I'm gonna grab a little. Okay, there's a half. And so then I'll put a full one in. Okay. So now we have 1.5 tabs. I'm gonna check it again. 50. Okay. All right, and then we need a digoxin. Let's see. 0.25 milligrams, 0.25 milligrams, 8 o'clock. Okay. So I'll punch one in there. Okay, and then like I said, we were supposed to give the Bactrim, but we are calling the doctor on that. Okay, so I'm going to make sure I have a full glass of water. Okay, Mr. Truman, I have your digoxin and your metoprolol. And then the water. Of course, I'll make sure you're sitting up. And then I would throw these away. Very good. So the doctor has ordered Bactrim, and you're allergic to sulfa, so we are actually waiting to hear from the doctor to see if we can get a different kind of antibiotic for you. So when you go to get up, you may feel some dizziness. So I would like you to push your call light so we can assist you. When you do go to sit up, change your position slowly. And if you have any trouble breathing, your vision changes, hearing even, please let me know. Okay? All right. That will do it for the 8 o'clock med pass. I will do hand hygiene. He's got the call light, bed's down, bed's locked.